everybody. How are y'all doing tonight?
Good.
Good? Okay, happy to hear that. So my name's Leslie Hubbard. I'm one of the program managers at the Salata Institute. And I'm so excited that you're all here tonight for our Careers of Climate Action speaker series. I'm now super excited to introduce our speaker tonight. So we have Gaurab Basu, Dr. Gaurab Basu, and he's a primary care physician and director of education and policy at the Center for Climate, Health, and Global Environment, otherwise known as C-Change. And he's an instructor at the Harvard Medical School. His work focuses on the intersection of climate change, global health equity, human rights, medical education, and public policy. And Dr. Basu has developed and evaluated numerous innovative health equity curricular programs. He's the director of the Harvard Medical School's Climate Change and Health curricular theme. He co-founded the Center for Health Equity, Education, and Advocacy, and co-directed the Harvard Medical School Social Medicine curriculum. He also co-directs the Climate Health Organizing Fellowship. And he serves on the Education Committee at the Salata Institute for Climate and Sustainability. He's also received the inaugural Harvard Medical School Equity, Social Justice, and Advocacy Faculty Award and the Harvard Medical School Charles McCabe Faculty Prize at Excellence. And in 2021, Dr. Basu was named to the GRIST 50 list of national climate leaders. And in 2018, the Robert Wood Johnson Foundation named him a culture of health leader.
It's a weird
so many,
name.
I don't
It's a weird
it's a weird name.
term, yeah.
He serves on the Implementation Advisory Committee in the Massachusetts Governor's Executive Office of Energy and Environmental Affairs. And he's part of the City of Cambridge Mayor's Climate Crisis Working Group and its Net Zero Climate Task Force. His work has also been featured by NPR's All Things Considered, the Boston Globe, Scientific American, the BMJ, and the GRIST, among others. In terms of his education, he holds a Bachelor of Arts in International Relations from Brown University. He received his MD from Larner College of Medicine at the University of Vermont, and a Master's in Public Health from Johns Hopkins Bloomberg School of Public Health. And he completed his internal medicine residency training at Cambridge Health Alliance, which is part of Harvard Medical School. So please join me in applauding Dr. Basu for joining us today.
It's nice to meet you all. Thanks so much for, I'm honored to have you all come and have this discussion together. So I'll talk a little bit and tell you just kind of how I got into this work, how I kind of sized this up and think about it, but really hoping we can talk together, I think I'm still trying to figure a lot out, and what my role is, how we engage with this issue of climate change and how we can work together across our various interests and skills and interconnectedness to really make a better future. Well, I'll maybe start by saying, I'll tell you a little bit about my journey to climate, but I'll tell you it was a long journey, and it's only actually recently that I've come to do that work, and I think it's relevant to tell you kind of how I got into this work. Is that, for me, I think climate is about absolutely the science of emissions, the science of understanding these pollutants, in my work, really understand these impacts on health and public health and medicine. My job, I was racing over here because I was in clinic, and a lot of my work is data-driven science. My patients rely on me to know my stuff, right, on all the research. And every time I'm responding to a result to labs and CAT scans and things like that, I got to know my stuff and I got to know my science. And that's the foundation, right? But I think that climate is something, it touches upon something much bigger. It's about how we live together, how we take care of each other, how we build a world in which we can see our interconnectedness, we can see the challenges of how human societies have developed, and how we take care of each other. And the frames of justice and fairness and morality, even, I would say, are foundational to this, right? And it brings out the best in us, it brings out the worst in us. We're living in a very, very complicated time where there's tremendous raw pain everywhere, and every week, there's new tragedies that are upon us that we have to navigate. And climate is a part of that story, I think, about we are on this planet together, and how do we do this together? And what's so cool, to hear about all your different work, it's like this group should be together thinking about this. If you're a design person, a health person, an undergrad, a lawyer, scientist, we need everyone to come together, if we sit in our little spots and just think about it, we're not going to get to where we need to. And I get super fired up. I'll tell you a little bit about some of the places where I'm like the only doctor at the table, but I'm like sitting with a politician and an engineer and a startup, a solar startup, but I think like, for me, like getting a clean energy economy, getting clean transportation, getting public transit, clean buildings, those are like prescriptions, those are solutions that are health solutions. And that's why, I get really fired about health professionals kind of engaging with, well, what's architecture? What should it look like? How should we build our buildings? How do we rethink our transportation system? And the truth is we have not put health, we wouldn't be in this situation if we had if organizing principles for us was making a society that was healthy, you wouldn't have built things the way we did, right? And we know, that we knew about a lot of these health impacts for a long time. And so that's why, I think health offers you this opportunity to be a kind of a compass on where we should go. I can't build a solar panel, or I don't know a lot of the things that a lot of people who are working on climate solutions do. But I think that health voice is often lacking, especially I would say in policymaking spaces. And I feel like it's really important it creates an accountability, right? If you can make it. So I'll talk a little bit more about that. But let me just start by telling you a little bit about myself. So Leslie, thanks for that introduction. But I'll just say my roles real quick, and then I'll go backwards and tell you a little bit about my background. But so I practice primary care mostly 2 days a week, Monday, Tuesday. I'm in clinic most all of the day. And then at the med school, I'm kind of in charge of the curriculum there. And then I have this role at Harvard T.H as the director of education policy. And those are kind of the two areas I get really interested about. So I'll tell you about that. I like kind of being in academics, but really, I love being around really smart people. I love like being like, oh, okay, I know I'm gonna be on top of all the science, and because this community is just pushing me to always stay on top of everything. But I think we've got to make sure it just doesn't sit in academia, right? That's not gonna do anything for us. So I really like this kind of role of like translator, communicator, explainer into society. I think that's what we can all do, whether it's health or otherwise, but really having a foot really planted in society and understanding how this could mean something for people to get fired up. Like, I have a very basic theory of change that if you get people to like care deeply about this and feel proximal to it and feel emotional about it, and if you can feel like you're a part of it, that climate matters to the people they love, the things that they love. If you can just get people fired up about it, like and it's happening. I think it's happening right now. It's not, I'm making this up, that suddenly solutions just arise from everywhere. I believe in human beings being able to be ingenuity and creativity and commitment once they care about something. But we struggle with that, right? And misinformation and a lot of different interests are at play at that. But all right, so tell you a little bit about myself. So I think I always kind of start my own personal story with my parents. My parents had a tough childhood. They grew up in India, very poor, with very little, and had this immigrant story of coming here in their 20s and having very little here and really scraping through so that my sister and I could have all the opportunities, that I could sit in a place like this and be talking to people like you. And I always had this feeling of like, how come I kind of just got to sit on their shoulders and I got to just get all this stuff. And if it was for a few turns of their lives, my life would have been really different. And there's nothing so special about me. I just got this opportunity to have an education and pursue my interests. And so I just felt this like real responsibility, throughout my life of like, what does this mean? And I felt like because I was given so much, there's just this like sense of, how do I give? How do I understand my place in the world? How do I see human suffering and respond to it? So I was grappling with what to do with all that and was really not sure about, for the undergrads here, I don't know if any of you are thinking about medicine, but had a really complicated process of trying to understand if medicine was right to me. I did love Orgo, anyone in Orgo, and pre-med was not capturing my imagination of what it meant to speak to human suffering, right? And then when I was a sophomore, after my sophomore year of undergrad, I spent a summer in Baltimore. and I was thinking about being a teacher, going into education. And there was like 18 kids I was in charge of. It was like a summer camp. They were like 8 years old. And it was like a literacy camp. So it was students who needed a little help with reading, all Black students and coming from difficult neighborhoods. And I like fell in love with these kids. They were just the best. Like, they were so fun, so charismatic, so smart. And I just loved them, you know? And it was like a real awakening for me of like, as I, you know, was coming to like learn about their lives, that they had poverty, injustice, racism, all baked into their life already at such a young age. And it got me so upset, you know? And then one of my kids, she was diabetic. And so after lunch, she was to check her sugar and then titrate her insulin. And I knew nothing about anything about medicine at this point. I was 20 years old. But her sugars were kind of fluctuating and they weren't so great. And it was, I can't really describe it to you, but it was so it was so raw to me, you know, the idea that her health would be impacted. And, you know, there was some social barriers and all that. And that was a summer where it was like, there was something that captured me about health. And I think health was this vehicle of seeing people's humanity and this kind of caregiving practice. And there was something about like, if we're not making sure people are healthy, you know, that it's about their dignity and humanity. And I couldn't, it really captured. And so that's when I dug in and started to pursue medicine as an undergrad and then went on to med school. And then I'll fast forward a little bit, you know, being in, you know, going to med school, public health school, doing various projects. But I spent, I think, a lot of my 20s and early 30s, like with, you know, a lot of experiments of trying to understand what it meant to be a med student, public health student, doctor, exploring all these themes, you know. And so I was really drawn to taking care of people one-on-one. I love that. I did it all day today. And just, you know, getting to know people and their lives. And it's a real honor to be able to journey with them. And just viscerally felt also that there were structures in place, right, that was causing disease, that I couldn't just sit at the end of all these things happening in society. And yes, I want to give clinical care and medicine, but I felt like that was not the full story, right? That I wanted to go upstream. I wanted to see these structural forces and speak to them, because if we're creating a society that's creating disease, that's not good enough, right? Like, I don't want to just receive my patients after they're sick. How do we make a society that's healthy in the first place? And so, you know, was doing, you know, work abroad in India and Liberia, and asylum work and immigration work and a variety of different things. And wanted to get trained in a variety of different things. So medicine, public health, but also taking some courses at the Kennedy School, and Marshall Gans has been a big influence on my work, and community organizing, and, you know, policy and leadership, and really trying to learn some of these skill sets. And so I've always been a little bit drawn, you know, to these kind of in-between spaces, you know, of how, you know, we kind of organize our thinking in these different schools or different disciplines, but I've always been drawn to this idea of like, you know, how do we lead, you know, and how do we build something better? And so, and to really have health in the front of that. And then education became this kind of weirdly, I didn't expect it. You know, part of me thought I'd kind of live abroad, you know, and work abroad. I have a young family now and all that. And I think, you know, doing global health work when you're mostly based out of the US is kind of complicated, right? It's, there's a lot of ways you can go wrong in doing global health if you're not living in the community and really understanding it. So I still really identify as a kind of global health, human rights person. But education it's not really just education. Like I kind of believe in getting people together. Those of you who know Marshall's work can see how it's impacted the way I talk about this, but, you know, gathering people, like saying the values, like declaring the values of what makes you feel alive. Like, what are those things that you believe in, that call you to serve, that should bring us together, to bring unity, and from there, like, to develop really deep relationships. You know, how can you find your people? how can you connect with people so that you can build not just good relationships, but actually strategically, it's how you build power, right? It's like how you build community. It's how, in the face of all these hard things, someone said the word community, right? How can you feel like you've got your people who've got your back, and you go to fight for these issues, and sometimes you're really tired or scared or overwhelmed, and you know there's this big body of people who've got your back and they're continuing forward. And I would, and then it's, you know, it is inherent in all of that is really this kind of power analysis, right? In a real justice framework of some people have power, some people don't. You know, Quara Jones defines structural racism as a system of structuring opportunity based on how someone looks that advantages some people, disadvantages some others, and saps the strength of all of society, right? And so the truth is we have created things that benefit some people and actively disadvantage people. Racism is at the center of it, as are many other structural oppressive factors. But inherent in kind of what I'm saying about getting people together and getting activated is actually really believing in human beings for all this stuff going on. And the tumultuous few years we've had, a few weeks we've had, I believe like we're built to take care of each other. I actually really am grounded in that. My 6-year-old and 4-year-old really reinforce that for me, that we're built of good stuff. And if we can get structures better, if we can kind of create cultural norms where we're like trying to take care of each other, I welcome you saying that sounds naive, but I actually like firmly believe in that. And I think that we've just got to put the preconditions in place so that we can open ourselves up to that. So I haven't said anything about climate yet. And it's because because it was only in 2018 that, so I thought climate was important all this time, right? I was like, climate matters a lot, and we got to get going on it, and it seems like we're making some progress, but I will admit to you, I can remember in like 15 years ago or so, like talking to one of my college friends who was doing environmental health in New York and saying, I know the environment's really important, but there's so many people suffering and we have to take care of that first, And yeah, I know it's important to like not be ripping down these forests and all that, but like look at these human beings suffering around the world. And that was a real blind spot. I mean, that was a real misunderstanding that we cannot take care of each other without taking care of our planet, right? That it's fundamentally connected of the way the health of our planet is a fundamental precondition for human health. And then the 2018 UN IPCC report, you all know about the IPCC. Make sure you check it out if you haven't, but it's the gold standard climate scientists around the world that come together every few years. The last one was earlier this year. That report in 2018, I don't know if you remember that one, that was the 1.5 versus 2 degrees Celsius and explaining the different impacts. That just woke, it was like a thunderbolt. I mean, I can very actively remember, I think it was just about 5 years ago, like any day. It was October 2018. And it was like this Sunday morning, and I was kind of waking up and kind of rolling out of bed, and I got permission to sleep in, I guess, a little bit. But I like looked at my phone, and it was a top headline in the New York Times saying, crisis expected far sooner than previously understood, or something like that. And there was like a skeleton of a cattle like in a desert, and it was like this very stark photo of like death and overheating, and I started reading this article, and it linked to the UN report, and it literally just like came together for me, like in that moment, like within 5 minutes of reading this, I was like, wait a minute. And I think it's a credit to those scientists because they really wrote that report really well, but I couldn't totally see it. And then suddenly I could see it everywhere, and my wife was pregnant at the time. I showed it to her. My hands were shaking. She was playing with her 2-year-old. And then I just felt like I knew I had to change, I had to incorporate it into my work. And I stayed up really late after everyone's going to sleep until like 1 or 2 for months, just reading and trying to understand like what it could mean. And was very open to thinking about, should I change my career? What do I do about this? But I would identify the people who were describing the fear and paralysis. I mean, those were like really strong for me. And grief and depression, I would say. Like it felt so messed up and so unfair that we could be doing this to future generations, that the global South was disproportionately impacted, that Black and brown communities in the US were disproportionately being harmed. I was angry and like overwhelmed, like I was really stuck. And I would say got some bad messages that it's all over, it's so sweet that you just realized this, there's really not much we can do, and we've got to get ready for a primal time in which we're scavenging for basic needs and all that, which was wrong. And I actually am pretty upset that people told me that when I was trying to understand this. But at the end of that process, what I would say is I realized actually, I just had I came to this conclusion. I would argue everyone in this room, let me pitch to you that this is true for you as well, that my end conclusion was I had to be who I was, and that actually being a doctor, thinking about leadership, thinking about public health, thinking about public policy, I am very policy oriented. I think the answer to most all of this is policy. But that I could try to impact policy through my voice as a doctor, and that I had to lean into all these, what I was doing in India and Liberia and in, the asylum work and immigrant work. Like I'd been thinking about all these things, and climate was just very proximal to all of that, right? And I just had to create that bridge, right? So I did, in really real ways, change my career and dive into new work. But it actually felt pretty natural. It was actually like, there was a lot I needed to learn, but at the same time, I was really ready for it. I was like really ready to receive it and build the connections, and keep going with it. And so, that's I've been doing this work and teaching at the med school and social medicine and all that stuff. So I just started kind of building it into everything I was working on, and I got these opportunities at Sea Change and all that. So I'll add just maybe a few projects I'm working on just to tell you a little flavor of kind of what I'm working on, and then maybe we can talk. Does that sound good? So I'll give you, just to give you a little flavor of kind of how, and again, this is kind of like, I love feedback. I'm like, seriously, still, I am 41 and still really thinking about how to make impact. And I think hopefully you've seen the story. I'm making the argument that we've got to see the world, see how it's changing, and react to it. I think a lot of people, when they get in the middle of their careers, are like, I'm an expert in this thing. I got to keep going because that's how, especially around here, right? Like, I got to keep going in this pathway and be the expert in this thing. And yeah, I can see that's kind of important. I would say I was kind of surprised with some of my mentors, like, hey, this is like, have you thought about climate change? Well, that's not my thing. It's all our thing, right? And we can be open to adapting to new understanding of the world's needs and be thinking about how to change, right? And that's a healthy thing, being shut off and just driving down a tunnel without thinking about what it means to the world's needs. I don't know. I don't know if that's exactly what we should be doing. And I might be restarting, in some ways, but I think that's okay. But anyway, so I'll give you a few examples of things I'm working on. So one is this cool fellowship. We just launched our third year of doing it. So we have 40 fellows, so it's a fellowship that we're doing with Marshall Gantz's, Marshall and his people. So it's a cool medicine, public health, Kennedy kind of collaboration. So we have 40 fellows. This is the third time we've had them across the country. So these are folks in the middle of their careers. They're doctors, nurses, social workers, psychologists. So we have people apply as groups of 3. We ask 2 to be some health provider, okay? Like you're giving care to patients. And the third we suggest is like a environmental justice group leader, or if you're working on a hospital project, like a sustainability person in the hospital, things like that. And so they apply as a group of 3 with a project. And you could say, Gaurab, you're running a climate health fellowship. Shouldn't you be teaching them about climate and health? And that I'll tell you in a second what I do at the med school about that, and that's really important. But for this fellowship, they actually kind of know that stuff already. They're in their work already. They have some nonprofits they work with at home and all that. But we teach them about community organizing and public narrative and how to find all the things I just said. finding your value, or declaring your value. I think everyone knows their values, but declaring your values, finding your people, building your power. Like doctors are really bad at that stuff. You know, we haven't learned how to be like leaders in a lot of ways through our clinical practice, and we need some training to be able to understand a power analysis and strategy and doing that kind of work. So we just wrote a paper that got accepted to the school journal that's hard to get into, where we were measuring not only like how much they learned and how many skills they developed, but actually the most important thing I was interested in was a thing called self-efficacy, which is when it's your belief in being able to make change. It's the way I say it is seeing hard things and seeing yourself in the solution, like not shying away from big and hard things. But if I have self-efficacy and I see climate change, I'm saying, I'm going to dig in here and do something about it. And those scores really went up a lot. And their sense of purpose and community and stuff like that went up a lot. And then, we're doing this longitudinal study, but already there's some signs that they're actually having some impact on their local communities. Their projects were in creating tree canopies or sustainable foods in their hospitals. 8.5% of the US emissions are from hospitals. So, a lot of doctors are now working to decrease the emissions of the hospital themselves, getting it onto the legislative, a bunch of legislative goals in each state and stuff like that. So it was pretty cool to see doctors that do that stuff. I was saying like, all right, we're taking care of our patients, but we want bills to pass that are going to take care of our patients, and no one's thinking about them in these policy spaces. So, so that's been a cool project. And the med school, and a real credit to the med students who I'm working with too. We've worked together to make this curricular theme. So in January, we got a 4-year longitudinal curricular theme approved. And a real credit, I would actually say, to the dean who just retired, but was a real big support to us as well. So we built some climate content into every course before the students go off into their clinical work. And some of them are big. I get to give a big lecture for an hour on the first week of med school about climate change and advocacy. And some are small. Some is like going through the slides, and when you're talking about malaria, explaining how land use changes, flood, drought are all impacting malaria, right? It's not that I want anyone to like memorize one thing about climate change and health. It's that you have a practice of saying, wow, the planet is changing and warming, and that is shuffling things around. It's exacerbating health inequities. It's making diseases show up in places that weren't there before. That really impacts the way I should be thinking about my patients. I had a patient a few years ago that was hospitalized with West Nile encephalitis. Had West Nile in his cerebral fluid in his brain. And so it was hard to diagnose because we don't see West Nile here, and we might be seeing more of it with mosquitoes in Massachusetts. So, so it's just feeling that sense of professional responsibility to understand. Doctors really like to have order and like control over the data, right? And what's hard about climate change is like it's really scrambling stuff. During a heat wave, there's a thing called diuretics, right? That make people who have congestive heart failure, they have too much fluid in their body, right? And we give them medicine called diuretic to help them pee it out so their fluid doesn't build up too much, which can make them very sick. So the fluid gets out of their legs, don't get as swollen and stuff. But during a heat wave, if you're dehydrated, we could make them too dehydrated, right? How do I tell a patient, on this day, do it, like it's complicated. But we're trying to teach the med students about that. And then the public health school, we're trying to do a similar thing now where we're just starting this, but I'm involved in trying to make a concentration where we can create a climate curriculum. So in some ways, education is kind of like a boring, well, they're just classes. But again, I actually get kind of fired up about it because I love seeing people activated. I love people finding their sense of purpose and feeling like I can take big things on. And I think here, we've got really amazing people, or really capable people, leaders who are going to do a lot of stuff. And it's cool to see them have those light bulb moments also. All right, that's education stuff. I'll close in a few minutes here. But for policy, again, I like this space of being, a doctor, being at the med school and public health school. But it feels nice if policymakers feel like you're a trusted voice, right? That can give them some counsel about this stuff. And I'm struck at even really good policymakers who care a lot. This is like complicated stuff, right? We're in the weeds in our different disciplines, really thinking about all this stuff. But they need some counsel, right? And so, I've gotten the opportunity to work with the mayor and with some city councilors here. I live in Porter Square, so I go, whenever I'm running, I'm like obsessed with trees now. So City of Cambridge gets many emails from me about, hey, this tree needs, this would be a great place for a tree, that tree, and they're actually awesome. They always respond. But we put 10 trees on my little block because there weren't enough trees, and trying to water them and all that stuff. But so I'm a little bit of a thorn, but they've been very nice to me. But I think feeling a sense of civic, connection to where you live is important. I told you I'm kind of a global health person, but I still feel like, hey, you got to feel a part of the fabric around you. My kids are in elementary school now, and so, when the bus is just sitting there idling with the engine on, we got to talk about a policy about that, which there is one actually that wasn't being abided by. But those kind of things matter, and those aren't actually small. I think it's like touching upon something that can have spark people saying, oh, I gotta say a little something there too. So anyway, so for City of Cambridge, as part of this task force, there was a big bill that passed earlier this year, only a few months ago, the BUTO, it's a Building Energy Utilization Disclosure Ordinance. It was a pretty big deal. I think that it's probably one of the stronger city bills in the country that every non-residential building in Cambridge has to have net zero by 2035, and then all buildings by 2050. The big labs and all that, especially in Kendall Square and all that, are hard. They take a lot of energy, right? And frankly, we built a bunch of stuff with gas in the last 15 years that we need to just decarbonize now. We need it to be all electric buildings. The City of Cambridge is now creating some policies where any new buildings need to be net zero. They're doing a pilot for that. So talking about all, I've been testified for building code. I was like, I went to med school to talk about building codes. What am I doing here? But that is health. And I wish, and I'd love to. I'm not telling you much about all these kind of mechanisms, but gas stoves. 12.7% of childhood asthma cases could be associated with exposure to gas stoves, right? You've got nitrogen dioxide and carcinogens like benzene in gas stoves. Not to mention ventilation and air quality inside our buildings. So buildings are actually a big deal to health, right? But we don't think about that. We don't think about that as how we're building stuff. And then I'm on this advisory committee in the governor's office. We meet quarterly, and I would say one of the coolest things about that is building a lot of relationship with the environmental justice groups. So there's Green Roots, and there's ACE, and there's something called the EJ Table, is where all these nonprofits around Massachusetts kind of meet regularly and kind of organize their legislative agenda for the year. So I was supposed to testify for my dad's been sick, so I had to run over to California, but they were like, they often are like, or can you testify for us and be the doctor? And they're doing the hard work of trying to pass these bills, but they're really focused on air quality monitoring this year. And so a few weeks ago, they had a big a hearing on that. So I do a lot of things like that. And then, have this opportunity through the advisory committee to report directly to the undersecretaries in EEA and Melissa Hoffer's office as well. So I'll stop there. Let me say, I was going to say this at one point and I forgot to do it, but let me just kind of say real quick, and then we can talk about it more if you want to, or we can talk about what you guys are thinking about in your own work. But I think of climate impacting health equity through 8 major mechanisms. And let me start by saying, I'm saying climate change a lot here, but planetary health is really critical, right? It's not just emissions, it's pollution, it's ecological degradation, deforestation. We've got to embrace all of this, and we can't just be thinking about emissions. It's not going to get us to where we got to think about all these mechanisms of investing in our planet. But I think of these 8 mechanisms being extreme weather events have many and complicated and complex impacts on health, infectious diseases, food security, water scarcity, heat-related diseases, which is a bunch, every organ system. There's a bunch of things there. Air pollution, mental health. We don't talk about that enough. heat waves increase mental health utilization, increase gun violence, increases suicidality. There's a lot of big studies that have come out in the last few years. And then forced migration. And I think it's a little silly. I think it's clear that political conflict is impacted too. The scholarship on that is still sorting it out. But when you've got social instability and tension, and there's a decrease of resources, that's going to put a strain on existing strains, and people having access to food and water is obviously going to factor into that. And that's there's good reason I think in places like Darfur and Syria that it was a factor in making things worse. So anyway, I'll stop there, but I'm hoping I kind of conveyed to you in all these, I kind of sweep through a lot of different frames and thoughts and all that, but I do think this is a conversation about despair and hope and courage and building. And, again, I kind of go back to my parents. I think about Mandela, and I think about King, and I think about all these movements from generations ago that looked at very hard things, had no reason to believe that they were going to succeed, where they were proximal to danger far more than I am. And they just kept going, and they said that if you're angry or pissed off like that we're in this situation, we all should be, right? We should not be in this situation. And greed and corruption and all that played into this. But I kind of get courage from them saying we can look at these hard things, see our interconnectedness, our common humanity, and really root in this just like central belief that we have to take care of each other. And again, I know it sounds naive, but I actually believe we're totally built for that, and that we're wired for that. And there's just reports are coming out all the time. It's a hard thing to hold both of these things, right? That we've never had breakdown the way we have. I mean, the summer was horrible, right? To see all that. It's very hard to see all this. I go through my up and downs when I'm seeing all that. The breakthroughs are happening like never before. The breakdowns are happening like never before, but the breakthroughs are happening like never before too. And no one could have thought that clean energy would skyrocket the way it is right now. And we just got to keep going way, way faster. So I think this is holding all that stuff together and finding solutions in the middle of it. All right, thank you.
Awesome. So we have time for questions, and we have a mic if you don't mind coming up and using the mic as it connects to the video.
Oh, you see. Oh,
Yeah.
great. Thank you so much for coming to speak with us today. Especially appreciate your sharing your immigrant story.
Yeah.
As someone who's also second-generation immigrant, we to hear. And I really liked how you touched upon the interconnectedness of everything that you spoke about in your journey and your path. And even though it seems like, say, environment and health and all these other things are different disciplines, in many ways they are very interconnected.
Yeah.
I guess in my eyes so far, as mentioned, alum of the Harvard Divinity School, I work in the sustainable transportation field, and previously worked in healthcare, and also still very passionate about health. It's obviously health and transportation very closely connected. There are a couple, I guess, questions or probing topics and challenges in healthcare. I was wondering, I'll mention those in a moment, how you find that these are interconnected, and what are some solutions? There's 4 of them I wrote down that are quite troubling for me. One is the U.S. health insurance landscape and healthcare costs. I think one of the challenges is knowing that right now, 2023, over 100 million Americans, about 1 in 3 or 1 in 4, are in significant medical debt. Number 2, since you mentioned a primary care physician, the shortage of primary care physicians in this country, especially in rural care deserts. And number 3, holistic medicine and preventative care. So someone who is engaged quite a bit with classical Chinese medicine, I really think about holistic medicine, preventative care. I just want to hear your perspectives more broadly. And number 4, the mention of community engagement. How can we be culturally responsive, whether to immigrant groups or faith groups to others? So what do you think with some of these, either from health insurance, a shortage of primary care physicians, to holistic medicine, preventative care, also to community engagement, and culturally responsive approach? How are these interconnected? What are some solutions, whether policy or otherwise, that you might have?
Yeah, thank you so much. I mean, I would say the thing that ties most all of those pieces together is that, again, we're not a healthy country, right? Our health outcomes are not very good, and we're wealthy, and we have all these technologies and all this capacity, in our health outcomes, everyone's seeing it, right? That our life expectancy has not rebounded since 2020. And so that begs the question of what are we lacking that other countries that have less resources, less access to, longwood and all the different, extraordinary medications and breakthrough treatments that they have, like why are we not doing as well? And so that connects to the access to care and the availability of healthy food systems and a trustworthy messenger, where you have a primary care doctor who knows you for a long time and is, that's, I think you're reinforcing the point that we can't just receive people and then try to take care, there's major parallels here with COVID, right? Where we got hit so hard by COVID because at baseline, we have real health issues in the US. And so, like, if I'm worried about extreme heat's impact on heart attacks and strokes and obstetrical outcomes, if we're not healthy at baseline, those things are going to be worse, right? And then there's major equity implications on all of that, right? I mean, foundationally equity implications on all that. So they're all tied to, I spoke to Marquis' aide maybe like a year ago, and the way this aide was talking about I think it was like a Green New Deal for healthcare was something they were talking about. And they were saying that getting access to care, making sure people are healthy in the first place was a real climate resilience approach for them. Because if we're gonna, we have baked a lot of these impacts already. If we want people to be okay during heat waves or, other, if they get an infectious disease, et cetera, we've got to invest in health. And it's, I would go even more than just, access to care. Access to care is foundationally critical, but we also have to say, how do people have access to food? How do we get rid of poverty and racism and make sure people have a good job and don't have to run around doing 3 jobs like a lot of my patients are. So that would be my response to some of those comments, is that we've got to really ask ourselves hard questions of what it takes to be a healthy country and kind of like start from scratch in the way of our thinking. I mean, I would say, for like in my early career, I was really focused on healthcare reform and was a real advocate of a lot of the access to care stuff. But I don't think that's even the whole story, right? It's not just once people get into the door of healthcare, it's how people living their communities and homes can be healthy in the first place. And by, decreasing air pollution by itself is such a profound, I've had this thing I think about of like, decreasing these climate/air pollution impacts, mental health, and access to quality food. I've been feeling like those are 3 things that are just massive health interventions that, I don't think we do enough of.
Thank you. And also transportation, just thinking, how less, better vehicles on the road, better quality regulation in terms of what kind of vehicles are allowed, and also how can transportation play a role in healthy food systems in a community, in a neighborhood, and just what are the different disciplines that previously, even though, they're, good approaches to just thinking, okay, this is my discipline, this is my field, it's broadening horizon. What are the holistic possibilities when someone in transportation collaborates with someone in public health, collaborates with someone serving, low-income communities especially, and so having...
transportation is such a great example. I mean, transportation, #1 cause of emission in Massachusetts in the United States, first of all. But, we use this term called health co-benefits, which means that you have solutions that are good climate solutions and are immediately good health solutions. So we've got this big problem of everyone being in cars, and, Boston is one of the worst commute cities in the country, right? People are spending way too much time in their car, like transporting from one place for another. And we didn't have a built environment where, it's starting to get better around here, right? Where you're seeing the protected bike lanes and all that. But that people can move, right, in different ways, or walk in different ways, or use public transit. That's immediately better for their health to be more active than to be in a car all the time. Not to mention all the pollution and emission impacts as well. And then, allowing people just to be able to move through their communities and have access to, public spaces and all that. It's like the gift that keeps on giving, right? So that's maybe what I'll just say is, whether it's energy or transportation or buildings, if you do, it's hard and it's expensive and it takes, it's like we got to rebuild everything. That feels like, a lot of work, right? And it's a big investment. And let's do it, because it's going to make so many things better at once, right? And then I think you're going to see these life expectancy stories and all that change, but it takes that kind of ground up approach.
Thank you.
I think as you were making remarks and painting a vision for a healthier country, what's interesting in the context of global health and coming to the U.S. health system, which is a journey I'm currently on, is over and over again when we talk about the U.S. system, what comes up again and again is how important it is as a value for the country to have freedom and to have choice. And I think about how that value bumped up against a lot of public health protocols during COVID. And I think about some of the interventions you're talking about now to assure a healthy society, and wonder, where can that freedom and that desire for choice be harnessed as an asset rather than something that bumps up against best practices?
Yeah. Well, I love freedom and choice too, but I think it's we want people to have the freedom to thrive and have the choices to live a healthy life, right? And I think the misinformation stuff and just it's really hard, in clinic. It was really intense in 2021, but still, today also, patients really not wanting a COVID vaccine, and I know them really well, and they trust me a lot, and they say things they've heard that are very convincing to them, and so, I don't really believe we have real choice if we've been fed this, just scramble of information, and I think we've got to have, I'm talking about real robust democratic institutions here where we're giving ourselves an opportunity to have a real understanding of what the choices are, I don't know if I'm making sense there, but I think things have gotten so scrambled at how we decide things together that we're kind of just so polarized and so talking past each other that we've got to do some deeper work of saying, what does it mean to create a social contract together where we say, hey, we're living in a world in which decisions by the collective influence everyone. And what does that look like? What are the choices? We have to be committed to science and be honest and real about science. And we've got to have real processes where we are actually talking about it and making rules and norms together, And I think the lack of a public forum to really truly dig in, some of them I think are very straightforward and are right and wrong, I'll be honest. And others are complicated, right? Of saying how do we decide this? What are the there's pros and cons. You give some things up, you get some things out of it. But I think for me, the threshold is I want people to be able to do what's right for them, and then that, my job as a primary care doctor is to give good advice, and let people, do, let people on their way in deciding what they want to do with their health. But I think we've got to have a real conversation of what those things are. And the line I was getting at is you can't do something having choice doesn't mean you get to hurt other people. If your decisions harm people, if you're saying, well, I believe that, wind turbines causes cancer, but you're going to put fossil fuel in there that's letting a child go to the emergency room with asthma exacerbations over and over again. That's not real. That's not choice. That's impacting someone, that's impacting their health. And so that's again, I kind of go back to how do we take care of each other? How do we stop harming each other? And that's got to be a guiding principle of how we kind of navigate some of that.
Hello, thank you. I came in late, so I really hope that you didn't cover this at the beginning. I'm also a primary care doctor and an organizer, and one of the challenges that I come up against is that people might have the information, but there's a bit of a leap in terms of believing that you can do something about it. And just from this recent research that you've done, I'd love to hear a bit more about self-efficacy and how to actualize people and communities into a state of self-efficacy.
Yeah, I mean, I think one of the things we found, and what's your name?
Rita.
Rita, you were in our class. You were one of our guest speakers. I know you worked with Natalie on this. would love to hear your thoughts on this because you've done so much work on this. But so one of the biggest things we like realized with, again, in our fellowship, we're having a normal group is a doctor, a social worker, and a EJ leader, and what we tried to do is build into the team a bridge building thing, right? Of where people who are working together who probably should be like kind of fortify that up front. But I think with like doctors, like and I'm not saying this judgmentally, I think it's a good extent true for myself as well. We were in training for so long, we were in the clinics and hospitals that we didn't build relationships with people in the community. And there's a thing with doctors sometimes we just like want to barrel in and say, I got the answer, and because, it comes from a good place, but sometimes we don't realize that all the like wisdom and the lessons are already there. And like ask how we really partner and listen and engage and like offer value. And I try, that's, with my policy work again, is to like build these relationships with groups around Massachusetts and say, hey, I'm available, tell me how it can be helpful. And over time they were like, all right, we really need you in this or that situation, And so, but that gives me self-efficacy, to feel like I've listened and understood. And again, I think it's all just based on relationships, right? Is that you feel a part of a team. It's not about you. It's not about you being in the spotlight. It's about understanding what the needs of the group are, and this kind of commitment to the collective, and saying, hey, I have this skill set, I have this knowledge base, and you have this goal of passing a bill that's going to help air quality, that's going to really help my patients. Let me tell you some stories about patients, tell you some of the research, and then I think that in some ways we are going so fast, and rushing, and this is true for all parts of society, but I think in medicine we're so burnt out. We're so, it's kind of in this chaotic healthcare system, and, we're all just kind of fragmented and just trying to get through our day and, squeeze in more patients in and all that like I have found in much of my educational work that people are longing to be like, why did I start on this in the first place? And it really is, there's some real rootedness of like, I want to heal. I want to care. I want to like listen to my patients. I don't want to be rushed when I take care of my patient. I don't want to be this burnt out and all that. So we are kind of like, we're super conscious of just like being very protective of that like learning space and having, we play music and we like, we try to make it joyful and fun and like take on the bigness and say all the emotions, and give space, to slow things down and let people, it's a big commitment to take this fellowship. It's a lot of work, but we kind of just want people to settle into themselves a little bit and then ask these big questions. And then we have this term called, Marshall talks about this a lot, called Shoshen, which is beginner's mind. It's to like allow yourself to be like, ooh, I'm trying community organizing and I'm really bad at it. I'm trying to say a story, public narrative, and I don't know how to do this at all. And it feels good that I like know how to write a prescription, when I identify this this diagnosis. But again, going back to my kids, like that's what kids do every day, and if you allow yourself to like not feel like you've got to be an expert in it right away, but open your mind to like what could a beginner's mind be like, a growth mindset be like. I think if you allow yourself to have that, you can have a lot of self-efficacy.
Earlier, you touched on the importance of communications. When you do all this research, it needs to go somewhere. It needs to go to the public. Do you have any recommendations for someone who works in communications and wants to find a way to reach the public and arouse their interest and their passion for an issue like climate change?
Yeah, I think there's so many, I think there's a question of like, what do you want to communicate? Is it science that you want to communicate? Is it, policy opportunities? I think, I think it's finding an organization that you believe in, and saying like, I really, these feel like right answers. These are underrepresented voices. These are folks that have a lot to contribute, but aren't getting, in some ways communication is power, right? Like if you're able to get a spotlight on a message that you can influence the community, there's so many people have so many good answers to this. They don't get to get into spaces like that, right? So I think it's thinking a lot about organizations that aren't getting access to impact and should be. And like, effective communication, I think could be really helpful to them.
Thank you.
Yeah.
Hello, thank you. This is very interesting. And I have two quick questions. What do you see the main challenges for water scarcity, especially here in North America is going to be one of the main regions that will be affected by this. I think coming from the voice as a doctor, it has a lot of weight. So I'm very glad you're in this space because I was not familiar with doctors being in the space of climate. So that's why I was dragged to the conversation.
Yeah.
And second, in terms of mental health and climate, do you think that could be a way that, are they already doing studies on when we're trying to value nature? I've seen like they're already mentioning, but it's so hard to put a value. And I think should we even put a value, but where you're playing with economic projects, then the economic benefit is always wins over the mental health or nature. So do you have...
Maybe I'll take your second question first and then go back to the first one. But, let's go back to trees for a second. There was a big study over the summer that was in Lancet that showed that having 1/3 of an urban space covered by tree canopy could decrease mortality and morbidity by 30% and decrease, I think the temperature is 1.3 degrees Celsius by having 30%. So I don't want to, trees are not the answer to everything. I'm being a little tree intense here, but here's some examples, right? So heat is a big player here, severe heat on mental health. So there's this big BU School of Public Health study from 2022, an awesome group that I'm actually doing a project with right now, who found increased mental health utilization on severely hot days. Not just mood, but paranoia, schizophrenia, substance use disorder, suicidality, increased ED utilization of those. A good friend of mine from college is a gun violence researcher, found that, like I mentioned, there's increased gun violence on days of severe heat. And he found that if you intervene, and I don't know the exact percentages on this study, but if you increase tree canopies in those spaces, it actually decreases gun violence. So he's very into these community interventions, structural interventions to decrease gun violence. So, I get, economics, and it was past my pay scale to understand all economics of things, but climate change is very expensive. It's very expensive when it wipes out communities and you have to rebuild, when it gets everyone to the hospital and you need long, hospital stays, and you need people on more medicines because they're sick. It's crazy expensive, right? Climate solutions might seem expensive sometimes. It's like the most fiscally responsible thing you could ever do to invest actively in climate solutions, because it's to make people healthier and protect our communities. So, I think, the interplays are complicated here too. In like Chicago, there was hundreds of people who died in 1995 from the big heat wave there, and isolation and loneliness was like the biggest variable of who survived and didn't. Like if you were very lonely and isolated, you were much more prone to die. And that makes all the sense, right? I think like these were one of the blind spots when I was thinking about climate change. I didn't tell you a story of one of my patients who, I'll say a very small tidbit of him, but he's a young guy who was a farmer in El Salvador, and out of nowhere, he wasn't my patient. He went to the emergency room, thought he had a virus, like a cold, and his kidneys weren't good. It was like dramatic out of nowhere. And there's a phenomenon known as CKDU, or Mesoamerican nephropathy, where if you're out in the heat, in Central America, and Nepal, some other countries, that you get so dehydrated, right, that the blood flow to your organs are not good, and so his kidneys were not getting perfused by blood enough, oxygenated enough. His kidneys were in failure. He's on dialysis. He's my patient now. But that was part of my awakening of like, how are my patients getting impacted by heat, right? And so I thought a lot about mental health in this isolation, like my older patients, my isolated patients in their homes could be quite dangerous actually if I didn't understand. And so, we should be putting heat pumps in those homes, right? And we're actually working on a project to try to think about something like that, where heat pumps, you guys know about heat pumps, it's not a good name for them because they are cooling and heating. and use a lot less energy than air conditioners. But
Nice.
but I had a real blind spot. I think of my factory workers, my outdoor laborers. How was people in like Phoenix now? They're saying these outdoor laborers have to start at 4 a.m. in the morning. How is that going to impact their mental health, right? So I think again it starts from these like principles of like we have to value health and understand mental health is a central part of that, and work like heck to like. There's a lot of things I don't have all the answers because some of these are very daunting. What are you going to do to mitigate the impacts of things like extreme heat or PTSD after natural disasters and stuff like that? There's a study I just wrote a commentary on where they did a study in Australia where medical students went to an area of flooding, which we think a natural disaster, more likely to happen in the future with climate change. And they wanted to volunteer and help, this community, but actually were so impacted by the natural disaster, it impacted their own mental health. And so the paper was making the argument of like med schools have to really understand how to do these voluntary service work pieces properly. So super complicated stuff. But again, I just feel like if we make it a priority, solutions come, in a lot of ways. Your first question was
Water scarcity.
scarcity. Yeah, that's a really hard one, right? Because the U.S. I would argue that scarcity is there's countries that are running out of water already. That were running out of water. I think Uruguay. There was a big paper on Uruguay that major crisis in it. So around the world, I'd probably highlight the impacts of water scarcity around the world. But in the U.S., you're seeing it this year. Like the West is getting very, very dry. The list last year was not true for that, but in a lot of ways, the Western, North America is getting very dry, and the East is getting very wet, and it feels daunting, but I think it's like a fundamental retake on our water infrastructure. How you can try to, how you can collect water and distribute in a way in which you're trying to mitigate the impacts of drought and flooding, right? So Cambridge has done a pretty good. This is one thing I learned on that mayor's task force is that I'm not going to say it exactly right, but there was like a dam. There wasn't a dam. There was they reworked an area like a reservoir and understood that if they changed the way that water was coming into it during severe weather, it would be really protective of flooding. So I think, as I understand it, the city of Cambridge actually has done a really nice job of thinking about flooding, but it takes a lot of work and infrastructure to be like, how do we make sure places don't, and these flash floods are really scary, right? They can happen out of nowhere very quickly and cause a lot of danger. And it's hard to make an infrastructure for, events that may or may not happen. You don't know when the next one's happening. It was a 1 in 100 event and now it's a 1 in 10 event. You make an infrastructure around that event, a 10-year event. But you got to, right? Like we didn't build an infrastructure for the world we're in right now or the world we're headed into. And whether it's water scarcity or otherwise, we've got to the other major thing I would say is that the way we use water is wild, and food policy is a really complicated thing, but most of our water goes to, feeding, cattle, like unsustainable food systems, and so, and our usage of water and things like that, I think, pools and stuff like that, I'm from California, everyone has a pool in their backyard. You got to think about, how we're using these natural resources, and there's been a consumption just having more and more that, people are extracting from groundwater and stuff like that. So big questions. I definitely don't have the answers to all of them, but I think actually if you get some of those other big pieces, especially food policy, it completely changes, water use. So climate change is a part of it, but the truth is we have not used our water very well for a variety of reasons, and you got to hold all of that together, and thinking the solutions.
Thanks.
So you've mentioned that you've been working with policymakers and do some consultation from your perspective as a doctor. So I wonder, I'm sure when people from different backgrounds meet, there's always going to be divergence and conflicts in terms of how they think things. So can you share with us some of the like unhappy stories you have when working with those people, and how these things work out in the end?
Yeah, well, I'll tell you one that made me pretty angry, and then surprisingly worked out for the better. So let's go back to buildings. Okay, so I remember this was probably like in 2018 or something like that. I was doing some work to improve the building codes for state policy. And when I say I was doing work on, I mean, obviously the nonprofits were doing it. They asked me to join in at like timely. So I don't like act like I'm doing too much here. But I kind of, my approach is to like really meet with these organizations, have, regular check-ins with them and figure out when I can help them. But for this one, there was building codes were really an important state policy. Buildings are a big part of our emissions in the state. And I went to a building codes meeting. I was like, what is, what am I doing here? What does that, have to do with my work? And I was really upset because I remember I had this very prepared thing I was going to say about why decreasing building emissions and decreasing indoor air pollution was really important. And there was just all these people testifying, and there's no connection to the urgency of climate change. The conversation was meandering, and it was it just didn't capture the fact that if you keep building buildings with gas, we're digging, we have to get to net zero. That was what we're saying. We got to end fossil fuels, and we're just building a bunch of new stuff that commits for decades a fossil fuel pipeline right into buildings. So, I'm by disposition, I'm kind of a diplomatic, bring people together, but I was kind of hot under the collar. I remember, and I was testifying to this bureaucratic entity that decides building codes, and so that's another story here, is that a lot of decisions will be made by a lot of bureaucratic entities without health voices there or people speaking up. And I remember saying I have to tell you, I'm not going to say my prepared comments, but I was very off the cuff, but I was I truly don't understand what this conversation has been like today, and it does not capture what climate change is doing right now. And so I told a few stories about my patients, about the impacts of heat and air pollution and things like that. And I'm not saying I'm truly not saying it's I did such a good job or something, but the room changed kind of, because I felt like people really agreed, but no one had just said it, that we're what are we talking about here? And then, I think the reason I believe in this health voice a little bit is that there is this moral accountability when you start putting human faces, and it's not just about this industry or that industry or even this emission or that pollutant, but you're this human being is going to be impacted by your decision. Do you understand that? I was struck at how they couldn't get around that. That was kind of that stopped, that worked to say, you got to think of this person. And people started doing that. But it felt, so that proposal was to have net zero buildings as a stretch code, an option by 2030, which also felt like a really not good. And that was a very ambitious ask. And I was but so we're going to make it an option by 2030, but we're going to spend another 10 years. And then, so I remember just being what's the point of any of this? Nothing, we're so off course. And then I testified at the State House one day with this guy, Matt O'Malley, who was a city councilor. And I remember being deflated that day also. And he was don't worry, things are actually happening. And I was what are you talking about? And then, a year or so later, when Mayor Janey was in office, and then Reverend Marama was a big part of that. He was in charge of the chief of energy and environment there. Matt O'Malley was a city councilor involved as well too. Passed this big bill where they fundamentally changed building codes in Boston, not in 2030, but right away. And then the state passed some bills with this pilot where 10 cities around the state are going to try all electric buildings. Again, I don't think, we got to keep going, and none of this is like we should say it's a big success. We've got to never feel like it's enough. But what I'm highlighting there is I felt so deflated by like 2 or 3 hearings, and I was like, we are so off course. And unbeknownst to me, a lot of people were really savvy and smart and were doing really hard work, nonprofits, politicians, advocates, and made something happen that didn't seem even on the menu of options when I was like testifying a year before. And it was like, wait a minute, this bill just passed, and like that's more than I could have ever dreamed of, And then I told you the city of Cambridge, I think, did a pretty good one too. So I think this is the work of I guess maybe I'll end with this, is like, this is like the work of imagination and transformation, and the world is just a line of stories of things that felt completely impossible. 25% of people were literate 100 years ago, and now it's 87%. Like if you look at under 5 child mortality in the last 25 years, it's plummeted, right? There's like unimaginable good that happens all the time. And so if you look at climate change right now and you say, we're headed to 2.5 degrees Celsius of heating, of warming, we're not getting the bills we need passed. We don't have the, I'm going to Dubai this December and we'll see what happens at COP this year and all that. But if you're saying like, we're not anywhere where we need to be, the impossible becomes possible very often actually, and it's just persistence and resilience and just keep going and finding your people and like things can happen. Someone said the word uncertain at the beginning, and that's real. It feels uncertain. I think about this as a dad a lot. It's very emotional for me too, and it's hard. It's a very hard issue, but I think we have to have the courage to like imagine and believe in the possibility of transformation, because it does happen. It's not guaranteed in any way. It's not usually happens. It happens with great fight over long periods of time.
And why?
It's a great note to end on. The impossible is possible with constant persistence. So unfortunately, we need to wrap up tonight. Thank you so much for being here today. And can you share how students can find you at Harvard?
Yeah, I'm happy to give my email. I'm gbasu at hspc.harvard.edu. So GBASU. Happy to talk to anyone and try to think of anyone who could support your work if you're thinking of a project.
Great, amazing. So, Jeremy, a round of applause. Thank you so much.